Welcome to this pharmacology quiz in the Quick Pharmacology Test Series focusing on fluoroquinolones. In this video, we will review key drugs from the fluoroquinolone class and their roles in managing infections such as urinary tract infections, respiratory infections, and gastrointestinal infections. This quiz contains 10 recall-type multiple-choice questions designed to test your pharmacology knowledge. Each question includes 5 options followed by the correct answer and a brief explanation. After each question, the video will pause for a few seconds so you can attempt the answer before the correct option is revealed. So, let's get right into it. Question 1. Which antibiotic acts mainly by inhibiting bacterial DNA gyrase and topoisomerase 4, producing concentration-dependent bactericidal activity? Option A. Ciprofloxacin. Option B. Azithromycin. Option C. Doxycycline. Option D. Linezolid. Option E. Nitrofurantoin. The correct answer is option A. Ciprofloxacin. This is because ciprofloxacin is a classic fluoroquinolone that exerts bactericidal activity by inhibiting bacterial DNA gyrase and topoisomerase 4, thereby preventing DNA replication and transcription. The other options belong to different antibiotic classes such as macrolides, tetracyclines, oxazolidinones, and urinary antiseptics, which act through different mechanisms. Question 2. Which statement about fluoroquinolone pharmacokinetics is correct? Option A. Food abolishes levofloxacin oral absorption completely. Option B. Ciprofloxacin chelation reduces absorption with antacids. Option C. Moxifloxacin is eliminated mainly unchanged in urine. Option D. Nalidixic acid has excellent cerebrospinal fluid penetration. Option E. Fluoroquinolones are inactivated by hepatic first pass. The correct answer is option B. Ciprofloxacin chelation reduces absorption with antacids. The explanation is that ciprofloxacin forms chelation complexes with divalent and trivalent cations such as magnesium and aluminium in antacids, significantly reducing its gastrointestinal absorption. All other statements are incorrect because food does not abolish absorption, moxifloxacin is largely hepatically cleared, nalidixic acid has poor CSF penetration, and fluoroquinolones are not inactivated by first-pass metabolism. Question 3. Which of the following statements about fluoroquinolone adverse effects is incorrect? Option A. They may prolong the QT interval. Option B. They can precipitate tendinopathy and tendon rupture. Option C. They are reliably safe in myasthenia gravis. Option D. They may cause dysglycemia in vulnerable patients. Option E. They can increase Clostridioides difficile risk. The correct answer is option C. They are reliably safe in myasthenia gravis. The reason is that fluoroquinolones may worsen neuromuscular weakness and can exacerbate symptoms in patients with myasthenia gravis, making them potentially dangerous in this condition. The other options describe recognized adverse effects including QT prolongation, tendon injury, dysglycemia, and increased risk of Clostridioides difficile infection. Question 4. Which fluoroquinolone is most associated with useful antipseudomonal activity among commonly used oral agents? Option A. Moxifloxacin. Option B. Delafloxacin. Option C. Levofloxacin. Option D. Ciprofloxacin. Option E. Norfloxacin. The correct answer is option D. Ciprofloxacin. This occurs because ciprofloxacin has particularly strong activity against gram-negative organisms including Pseudomonas aeruginosa and is widely used for infections where this pathogen is suspected. The other fluoroquinolones listed have weaker or less reliable antipseudomonal coverage. Question 5. In community-acquired pneumonia, which statement best compares a respiratory fluoroquinolone with a macrolide? Option A. Azithromycin has stronger gram-negative enteric activity. Option B. Levofloxacin lacks activity against atypical pathogens. Option C. Moxifloxacin covers pneumococci better than erythromycin. Option D. clarithromycin inhibits DNA gyrase like ciprofloxacin. Option E, ciprofloxacin is preferred for pneumococcal pneumonia. The correct answer is option C, moxifloxacin covers pneumococci better than erythromycin. This is because respiratory fluoroquinolones such as moxifloxacin have enhanced activity against Streptococcus pneumoniae and atypical pathogens commonly responsible for community-acquired pneumonia. The other statements are incorrect because macrolides do not inhibit DNA gyrase, ciprofloxacin is not preferred for pneumococcal pneumonia, and respiratory fluoroquinolones do cover atypical pathogens. Question 6. Regarding urinary tract infection therapy, which statement is correct? Option A, nitrofurantoin achieves high serum levels for pyelonephritis. Option B, fosfomycin is preferred for pseudomonal prostatitis. Option C, ciprofloxacin penetrates prostatic tissue better than nitrofurantoin. Option D, trimethoprim never reaches therapeutic urine concentrations. Option E, amoxicillin is intrinsically superior against resistant gram-negatives. The correct answer is option C, ciprofloxacin penetrates prostatic tissue better than nitrofurantoin. The explanation is that fluoroquinolones such as ciprofloxacin achieve good penetration into prostatic tissue and are often used for bacterial prostatitis. The other statements are incorrect because nitrofurantoin does not reach high serum levels, fosfomycin is not preferred for pseudomonal prostatitis, trimethoprim does reach therapeutic urine levels, and amoxicillin has limited activity against resistant gram-negative organisms. Question 7. Which fluoroquinolone is least suitable for uncomplicated urinary tract infection because of relatively weak urinary utility and stronger respiratory emphasis? Option A, levofloxacin. Option B, delafloxacin. Option C, ciprofloxacin. Option D, moxifloxacin. Option E, ofloxacin. The correct answer is option D, moxifloxacin. This is because moxifloxacin undergoes substantial hepatic metabolism and achieves relatively lower urinary concentrations compared with other fluoroquinolones. The other agents produce higher urinary drug levels and therefore have more clinical utility in urinary tract infections. Question 8. Concerning special populations, all are true of fluoroquinolones except Option A, they are generally avoided in pregnancy. Option B, they are used cautiously in growing children. Option C, elderly patients may have higher tendon risk. Option D, renal impairment never alters dosing requirements. Option E, CNS toxicity may be more frequent in older adults. The correct answer is option D, renal impairment never alters dosing requirements. This occurs because many fluoroquinolones are partially eliminated by the kidneys and therefore require dose adjustment in renal impairment to avoid toxicity. The other statements are correct since fluoroquinolones are usually avoided in pregnancy, used cautiously in children, and associated with higher tendon and CNS adverse effects in elderly patients. Question 9. Which statement about individual fluoroquinolones is correct? Option A, moxifloxacin is preferred for Pseudomonas aeruginosa. Option B, ciprofloxacin has poor activity against gram-negatives. Option C, levofloxacin has activity against atypical respiratory pathogens. Option D, norfloxacin is preferred for severe systemic sepsis. Option E, ofloxacin is inactive after oral administration. The correct answer is option C, levofloxacin has activity against atypical respiratory pathogens. The reason is that levofloxacin is classified as a respiratory fluoroquinolone with good activity against atypical organisms such as Mycoplasma and Chlamydophila species. The other statements are incorrect because ciprofloxacin has strong gram-negative activity, moxifloxacin is not preferred for Pseudomonas, norfloxacin is not used for severe sepsis, and ofloxacin remains active when given orally. Question 10. Which fluoroquinolone has comparatively greater anaerobic and MRSA-related utility than older members of the class? Option A, norfloxacin. Option B, delafloxacin. Option C, lomefloxacin. Option D, ofloxacin. Option E, nalidixic acid. The correct answer is option B, delafloxacin. The explanation is that delafloxacin is a newer fluoroquinolone with enhanced activity against gram-positive organisms including MRSA and some anaerobic pathogens. The other listed fluoroquinolones are older agents with limited or poor activity against MRSA and anaerobic bacteria. The quiz is now complete, and thank you for taking part in this fluoroquinolones pharmacology quiz. Please drop your score in the comments so I can see how you performed. To strengthen your understanding further, consider reviewing Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF. Any treatment guidance mentioned in this video is aligned with information provided in the BNF. Subscribe to the channel for more pharmacology quizzes and learning content.